Hello, I'm Mary Rockwood Lane. I'm a professor here at the College of Nursing at the University of Florida. I'm recording this video from my studio because I'm also an artist and I teach creativity and spirituality and healing. What the video is going to be about is using art as a way of healing, which is a very, very timely subject for nurses now and today. How can we begin to integrate the arts into clinical practice? I'm going to start with my personal story. In 1991, I had a very serious illness, and I ended up discovering art in my life, and I ended up painting portraits. And this was such a powerful personal experience where I painted these portraits and I had never painted before. And I ended up discovering that I was an artist when I never had any idea of that. But it changed my life so much that I realized everyone is an artist. And when I painted these paintings, it was a very healing experience. I was so excited about this, I decided to go back and start a program to bring artists, musicians, dancers, poets into the hospital, invite patients to make art at the bedside. So at that time, I worked with a medical director on oncology, and I started the first unit at the University of Florida, and it was the bone marrow transplant unit. I worked with the nurses and the physicians and the staff, and we began to explore what kind of arts would be appropriately working with some of the patients and families. And at that time, it was a very challenging unit. It was in isolation, so we knew that this unit would be the best place to start to explore what the possibilities would be. So we began by creating an art studio on that unit. And we started an art cart where we had art supplies available for patients. And then we also had cassettes and CDs so patients could pick out the music they wanted to listen to. Not only did we have art supplies, but we also began to invite artists in from the community. We invited musicians to come in and do concerts in the hospital. We also invited musicians to go to the different units and sing with patients and families. We also invited dancers. They would come in and they would get patients up and out of bed and begin to dance with them in their rooms. Even if they couldn't dance, they could wave their arms and begin to do movement so they can begin to move their bodies when they were bedbound. There were many times when patients had no experience of making art, and we would introduce art supplies, and when they began to draw, they would draw a series of paintings that were very powerful. And there was one patient who drew 75 paintings, and he said that it totally changed his life when he was experiencing a bone marrow transplant, because he discovered through his art he was able to see that he was on a journey, he was on a healing journey, and he was going to get through this experience. And it was as if his paintings reflected that back to him. One of the things I learned when we integrated the arts into the clinical setting, not only did patients respond, but nurses and physicians and artists, we began to realize that art was a way of making the patients feel cared for. It may not have what we realized, that the experience of them sharing their art with the caregivers was as important as anything else they did, and they discovered how powerful their art was. And we ended up making tiles that we put all in the hospital. We ended up making ceiling tiles where the ceilings in the hospital are all full of beautiful images on the ceilings. We ended up creating gardens and sculptures all over the hospital. There's musicians almost on every unit. And what happened when we first started this arts and medicine program, we realized this was one of the first artist in residence programs where we actually brought the arts to the bedside with patients. Hospitals all over the United States began integrating the arts and realizing how powerful the arts were in healthcare. So what I'd like to talk to you about as nurses is how can we integrate the arts into our clinical practice as advanced nursing therapeutics. How can we bring and invite our patients to integrate music, for example, integrate movement and dance when we ambulate our patients? How can we use our voice to create a way of communicating with our patients that's more powerful? How can we create beautiful environments in which the patients thrive? One of the things I was reading in Florence Nightingale's work, who's the founder of nursing, she talks about, in Notes in Nursing, she talks about how important it is to create a healing environment. That patients, when they have something to look at, or they can look out a window, or someone brings flowers in the room, how it changes the whole environment. So how when we bring beauty into a hospital setting, how much of a difference it can make in patient care and their experience. And one of the things we're focusing on is how can we really treat the whole person as nurses. And I wanted to share with you the research I did as a doctoral student. I did a hermeneutic study where I basically did a qualitative analysis of patients who shared their experience of using art and was able to articulate that it was a powerful healing experience. Many of the patients began with a story of when they first got diagnosed with their condition, where there was pain, there was suffering, there was crisis. They started their story at that moment. And then when they were invited to make art, or they began to make art, it's if something inside of them shifted and they began to explore new ways of expressing themselves, despite the suffering and pain. So they could transform this story into something that was creative, which led them on a journey of their personal self-exploration, also tapping into their inner creative resources. Everyone is an artist, so one of the important things is invite patients and yourself to explore different mediums that resonate with you, allowing yourself to explore what you would like, what different mediums you would like to work with. The other thing the patients talked about is how when they start making art, they would move into a flow of creativity. It happens like even when you, for example, when you turn on the music and you listen to a song, it takes you away into the experience of the music, into the song itself, and it can transform your experience from what it was a minute ago to what it is now when you're listening. That's how powerful healing with the arts can be. The other thing I wanted to share with you is when a patient would talk about, or anyone who used art as a way of healing, they talked about inside the creative process, they experienced a turning point in which they slipped deeper into their own inner world. And they were able to express themselves at a much deeper level that was profoundly healing. They were able to move inside themselves and tap into their own creative resources. One of the things they talked about is they would also have an experience of witnessing themselves. Witnessing through their own art a reflection of their experience that allowed them to see themselves more deeply and more clearly. And this is very powerful. They were able to name the experience, see the experience, express the experience. And this was a powerful shift in what was happening to them. They also were able to recognize their expression, whether it was a poem or a dance, or whether it was a painting or a drawing, that it was the truth for them. It was their truth. And they were witnessing themselves at this point in their life. And that can be very liberating. The other thing they talked about was, and I remember this clearly when I was painting, when you're creative and you're expressing yourself, authentically and purely in a creative experience, and you're recognizing yourself. I remember when I was painting my portraits, and I painted the first portrait where I felt extremely painful, so I was expressing the pain and the despair that I felt. As I began to move through the paintings, I noticed I was getting stronger. My paintings, I could see in my paintings that I was healing, and I was able to witness myself and actually feel compassion, and a radical compassion for what I had been going through. And that in and of itself was very powerful. And when I was doing my research, it was very beautiful because people would talk about a moment when they touched the spirit of themselves, something greater than themselves they experienced through their own creativity. And what I would call this now, in retrospect, it would be called transpersonal knowing. Knowing yourself at a deeper level than you knew yourself before. So creativity can take us on an inward journey that's very powerful, very transformative, and very healing. So I want to invite you to really begin to first explore yourself. Do your own creative process as a beginning. Start your own journal. Listen and make your favorite playlist. Start using art in your life and exploring the power of the creative process in your own personal life as a way of self-care, as a way that you can become more whole and healed for yourself. Because I realize when we start with ourselves, we start with caring for ourselves, we start with our own personal healing, that in and of itself can change our practice. It changes us so we can be more caring, more present, more authentic in our practice. And it's healing for us. And we're living in a world where we're focused on tasks, we're focused on procedures, we're focused on surgery, we're focused on medication. And it is so important that we expand ourselves as nurses to think of other ways of healing, from guided imagery, from music, from meditation, from song, movement, all kinds of creativity. It's not just limited just to the traditional arts, but it's how can we ask our patients to remind themselves, what are you most passionate about? Because that will bring them back into what they love about life and bring joy. So I want to share with you with a poet who's one of my favorite poets. His name is Rumi. And I just love his work, and his work has inspired me and inspired my poetry, because when I started painting, I ended up painting, and then I ended up integrating the arts into healthcare, and then I ended up becoming a researcher, and I ended up becoming a writer. I've written many books, and I ended up becoming a poet, and now I'm returning to my painting. But when I was really into my poetry, Rumi inspired me. Keep walking, though there's no place to go. Don't try to see through the distances. That's not for humans. Move within, but don't move the way fear makes you move. Today, like every other day, we wake up empty and frightened. Don't open the door to the study and begin reading. Take down a musical instrument. Let the beauty we love be what we do, for there are hundreds of ways to kneel and kiss the ground. And I'd like to conclude with that there are hundreds of ways we can integrate the arts into our own lives and into clinical practice. We can invite our patients and families and colleagues to reclaim the artistry, the beauty in our lives, because it's such an important part of healing. I'd also like to conclude and invite you. I have a free online course. It's 6 weeks, it's 6 modules, and it's on Coursera, and you could get it through my website. My website is Healing with the Arts, And I would love for you to use this course and use it for your own creativity and share it with patients and families. Because right now it has 20,000 students enrolled in the course all over the world. And my dream is to create a community of people all over the world who are using art as a way of healing. And I invite you to be an artist and honor the healing energy within you. Thank you very much.